In today's Daily Health, a brand new report finds vaping among young people is on a steady decline, dropping to its lowest level in a decade. That's according to the Centers for Disease Control and Prevention.
More than 1.6 million students reported vaping in the past month. That's about a third of what it was at its peak back in 2019, when more than 5 million young people reported using vapes. Joining us now is NBC News health and medical reporter Berkeley Lovelace Jr. and NBC News medical contributor Dr. John Torres. Good to see you both. So, Berkeley, I'll start with you. What's behind this drop in vaping, specifically among young people and high schoolers?
Yeah, so interestingly, the drop was primarily driven by high school students. So the FDA and CDC said 1.2 million high school schoolers vaped this year compared to 1.5 million last year. There wasn't really a change for middle school students, but the CDC noted that drop has been happening since 2019. So the FDA has done a lot of work to crack down on vaping, particularly these fruity flavors that we also have heard about from Juul, and they say this appears to be working.
Yeah, Dr. John, you almost wonder if it's just not as cool as it was, or maybe that's not even the right word, right? Trendy, whatever they call it. It's been marketed vaping as an alternative to smoking that was safer. That is not necessarily true, right?
Exactly. It's not necessarily true. And we found out over the years that it's not as safe as we thought it was. And you're right. It first came out as an alternative to smoking because getting rid of cigarette smoking is kind of the end goal to all this. But it kind of switched from there. And like a lot of products, it went into this, like you said, this cool category where a lot of teenagers, middle schoolers and high schoolers ended up using it. And then we found out as time went on, we did more studies, that the vape chemicals themselves were causing a lot of issues. And there's a lot of health concerns behind it. Number one, you're putting these chemicals into your body. We know there's nicotine in there, which can lead to further addiction. And we were finding out that people, especially teenagers who vaped, ended up changing their brain development to a certain extent, getting addicted to nicotine and switching over to cigarettes. On top of that, some of the chemicals are cancer causing. They get those deep into their lungs because of the way they vape. Also, were heavy metals, nickel, tin, and lead being the biggest ones. And then there's particulates in that vapor as well. And those particulates, when they get into the lung, they can cause issues, granulomas, other things inside the lung. And the long-term consequences are unknown, especially with 15, 16, 17-year-olds.
Yeah, and you talk about young people still developing. Berkeley, we know a lot of these tobacco companies have been accused of marketing their products to young people. You talked about the flavors out there. How exactly are they targeting kids?
Yeah, that's right. And they're also becoming more dangerous. An expert I spoke with said that nicotine in these products contains about 200 puffs of nicotine, so equal to about a pack of cigarettes. And now they're containing as much as 15,000 puffs, so definitely dangerous amounts of nicotine. Right now, companies are still targeting kids with these fruity flavors that we hear so much about. These are mainly disposable vapes, not like the reusable vapes that we hear about, like from Juul. Also, kids are also using nicotine pouches, which you just ingest versus smoking, so they're more stealth-like. So kids can use these and, not get caught in school using them.
Yeah, I was just wondering about that, Dr. John, if that's maybe replacing some of the vaping use. Is this nicotine pouch you put in your mouth and you think it's, I don't know, it's just supposed to give you like a nicotine high, right?
And I think that's what happens is they are getting that nicotine high from this, but they're not looking at the other consequences behind it. And these pouches, again, were first marketed as an alternative to smoking. And, we have nicotine patches, nicotine sprays, and now they have these nicotine pouches, exactly, nicotine gum. Problem is who's using it now? We have these teenagers using it who have never smoked before, and they're using it to get that nicotine high, so to say. But, some of the issues we know about, gum disease, periodontal disease, high blood pressure, heart rate increases, which could lead to hypertension, cardiovascular disease, those types of things. What we don't know are the long-term consequences. Are there any cancer-causing issues that we're not aware of that we won't find out for 10 or 20 years?
Right.
And so, again, the big concern is, are they going to become addicted to these because they're high levels of nicotine and then switch over to cigarettes?
So given the negative health outcomes that Dr. John has described, Berkeley, let's end with you. What is the FDA doing, briefly, to crack down on stores and distributors who are selling vapes?
Yeah, so the FDA said it's working with the Justice Department to crack down on illegal sales. So one company they singled out was Elf Bar, a popular brand among teens. And so they've sent warning letters to 1,000 retailers as well as fines as well. So they're really cracking down on these as well.
All right, Berkeley Lovelace Jr. and Dr. John, thanks so much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.